And we are joined tonight, we're going to dig into some campaigns now, by Jessica Bauer Walker, the Executive Director of the Community Health Worker Network of Buffalo, and India Walton, who is lead organizer at Open Buffalo and also very active with the Fruitvale Land Trust. And I would love, since we're a small group tonight, to just hear who you are and what brought you to this workshop.
I'm Kevin Ketchum. I volunteer with the Campaign for New York Health, which is an issue-based campaign.
Great.
So, being a volunteer, I'm not a professional organizer, so I try to pick up information whenever I can.
Great.
I'll bring it back.
I'm a UB-MSW student. I'm interning with the Mobile Safety Net team.
Oh, great.
So it just felt like a really good fit. I was right around the corner. So I'm just going to come stop by after.
And what's your name?
Christopher Holman.
Great.
I talked to Kristen, I think. So,
Yes.
Yeah. Very nice emails. Thank you.
Oh, thank you.
Hi, I'm Megan. I'm with the New York Immigration Coalition, and I do a lot of campaign-based work and issue-based work. So, always eager to learn more from our comrades.
I'm Katie McGraw. I go to UB Law. I work in the community justice clinic there, so we also do a lot of issue-based stuff. And my professor suggested I come here and learn some more.
Is that
Nicole.
Nicole. Okay. Great. So that's a funny story. Nicole Halladay and her husbands they're both law professors at UB, and they started in Buffalo last year. And I went to NYU Law School some years ago in New York City, and Nicole Halladay was my clinical teaching fellow in New York City. And then I moved back to Buffalo and joined PPG, and they said, we've just picked our public policy professor fellow for the year, and it's Nicole Halladay. And I was like, oh, she's in Buffalo, and what's happening? So yeah, it's great to have her involved. So very good. Well, welcome everybody. I think we are going to dive right into learning about a couple campaigns. And I, as I said, lived in New York City, and I have done community level justice and criminal justice and refugee work, but also worked really globally with the UN community. And what I love about coming back to Buffalo and campaigns like this is that you can plan and measure and build these close working teams and really track your progress in ways that are really exciting. And I think these two campaigns show how much progress can be made. Not that it doesn't take a lot of work and plenty of years. So we're going to look at these two campaigns, and I'm going to ask, just to get us going, India and Jessica both a few rounds of questions, and then we'll open it up for discussion, questions from all of you. We're not going to go in detail through all of these forms and packets, but we've got some tools to send you off with as well. So first, India, I want to ask you about the background of the campaign that you're going to share about tonight. So several years ago, the Buffalo Niagara Medical Campus was opening its doors and getting larger and larger, very near to your home in the Fruit Belt. And you and your neighbors started to find that it was nearly impossible to park anywhere near your front doors. So can you tell us what happened and how did your neighbors first come together around this problem?
Sure. So I moved to the Fruit Belt in 2015. So the campaign was already in progress when I moved there, but it wasn't really. It would pass the Assembly and then it would fail in the Senate, and we couldn't figure out why. And eventually it was revealed that one of the labor unions on the medical campus had friends in Albany, and they would oppose it because the employees were afraid to walk through the neighborhood. So they wanted to park as close to the campus as possible so that they wouldn't have to see the people who lived in the neighborhood as they walked on their way to work.
And in case people don't know, go 2 steps further back for us to say what was happening in the first place to make this a challenge for residents.
Yeah, so first I'll start by saying that the Fruit Belt is like a neighborhood of 1,000 block clubs. They had already been pretty well organized, pretty high voter turnout, high percentage of homeowners, had decent relationships with our council person, and just maybe needed to ramp up the strategy with a little bit maybe more effervescent energy to get the type of media attention and things that would really draw attention to the campaign. I forgot what the question was, I'm sorry.
No, I was just saying 2 steps back, what happened from knowing is the medical campus starts building up. All of a sudden there's, I think, 17,000 employees of the medical campus.
Right.
And they're all parking on your streets.
Yeah, so
So why is that a problem?
They park in the streets because the parking on the campus is pretty expensive. It's about $89 a month for employees to park there. And also the Fruitvale, because it's an older neighborhood, one of the oldest in the city, there's lots of tiny homes with no driveways, so the residents rely on street parking, and people were parking blocks away from their own home, and you can just imagine what a barrier that is, trying to bring groceries home or wrangle and corral children and all the things that people have to do every single day. And also just being mindful that, like, when we think of the medical campus, we think like people are doctors, nurses, pharmacists, researchers, but there are low-wage workers on the campus also who the price of parking is a real barrier. But then there are just some people who don't want to pay, who feel like the streets are like public property. I can park wherever I want, and I'm going to park here and walk down to work. So it was really challenging because that was the narrative. These are public streets. They don't belong to anyone. You can't have permit parking on a city street. It's not possible. It doesn't happen. You're never going to win it.
So residents started to ask for residential parking permits so that you could park on the block where your home was.
Yes.
And do you know where did that idea come from, or what was the group of neighbors that was behind that in the first place?
Yep, so it was Fruitvale United, Fruitvale Homeowner and Tenant, Orchard Community Initiative, McCarley Gowden's Housing Task Force, a bunch of people. And we actually got a lot of support from Senator Kennedy, Assemblywoman People Stokes, and Darius Pridgeon. And eventually the medical campus agreed to commission a parking study to see how much traffic the medical campus was actually bringing into the neighborhood, what were peak times for parking, where people were parking, and it confirmed like what the residents have been saying all along, is that this flooding of parking was coming directly as a result from the medical campus.
Okay, so Jessica, I'd love to hear the background of your campaign that we're going to focus on, which I believe is that more than 5 years ago, students and parents really started voicing more concerns about health and wellness in Buffalo Public Schools, and conversations were started about how to improve that. So what were the main concerns, and how did concerned parents, concerned students start coming together in a more organized way?
So I got involved probably in 2010, and there have been parents that were working on this for quite a bit of time. We're having a lot of problems in Buffalo Public Schools. There's still problems in Buffalo Public Schools, but it was really bad then. Like, there wasn't even visitors entrance marks that you could get into the school, and just a really challenging environment in terms of health and safety issues with students, and in certain schools in particular. So when my daughter was in pre-K, she's in 6th grade now, so it's been a little while, I started to directly experience a lot of this stuff as a parent, and work with other parents at that time at the District Parent Coordinating Council to say, like, hey, we're seeing these things going on. Like, why are the kids not getting more physical activity? Why are they getting fed all this processed food? Why don't we have the types of health education and services that are necessary? The kids are gaining weight, and kids are engaged in really high-risk behaviors like sexual activity and violence, and the teen pregnancy rate seems really high. So we started to ask these questions and go to Board of Education meetings, and then we became connected to the Buffalo Public Schools administrator at the time, who was the director of health-related services, who was a very community-minded, family-oriented type of person, and she shared with us that there was this tool from the Centers for Disease Control and Prevention called a Youth Risk Behavior Survey. And she said, this might be a good advocacy tool for you. If you can actually get hard data, you might be able to show that the things that you're really saying that you're experiencing are the truth, right? Sort of like doing the parking study in the Fruit Belt, we needed some data. So we started to go and advocate for that and say this is something that we wanted as parents. The Board of Education agreed to do it, and then we had a data set, and it was a really troubling data set in terms of really high rates of mental health issues, engaging in unsafe behaviors, violence, drug use, sexual activity. really high obesity rates, and then we had the numbers for all of this kind of stuff, high rates of screen time. I mean, this whole set of data that really showed high-risk types of behaviors. So at that point, the Buffalo Public Schools couldn't just kind of sit back. There was hard data there, as well as parents going and telling their stories and mobilizing around this. So we pushed for a wellness policy, because at that time there wasn't even a district level wellness policy. And it was really a broad-based effort by all types of school stakeholders. We had administrators at a district and a building level, we had parents and students, we had health professionals and public health professionals, and community-based organizations that really came together and wrote this comprehensive wellness policy based on, at the time it was called Coordinated School Health, was the CDC framework. And we advocated for and got that wellness policy passed in 2012. So without getting into the background of the campaigns for implementing it, that's kind of how it all started, in getting the framework in place.
Very good. So to go back to the Fruitvale, I'd love to talk a little bit about what we're going to go into, which is one of the first steps in campaign planning, is choosing what your goals are. So it sounds like you got involved in this where there had already been a little phase of work, but that it needed to get a bit more strategic. So do you remember any goal setting process, or what long-term versus short-term goals the residents set together?
Yeah, we were fortunate to have labor and government at the table with us when we were thinking about it, but we came up with all kinds of crazy stuff. People really just wanted to park in front of their homes. They didn't care how we got it done, that's just what they wanted. So they were like, well, we're gonna have alternate parking every 2 hours. So people who work on the medical campus, they can't park here because they have to come out and move their car to the other side of the street every 2 hours. Or, you know, just all kinds of different things. And then we finally settled on the residential parking permit system as sort of the most effective and, you know, what do you call it? Something that's like makes sense. You know, it's a C word. I can't think of it right now. It's 6 o'clock.
Fair enough.
We settled on that as sort of the most comprehensive and feasible plan. We agreed to pilot it, to make it a pilot so that we could try it out and see how it worked. So originally we were going to have that the streets closest to the medical campus were 100% residential permit parking only, and then further away we would give half the street to residents and then half to medical campus employees. Yep, and then it was like 3 weeks left in the legislative session. It had already failed 3 times. The session was coming to an end, and we heard that there was rumblings of opposition yet again, and we had to do something. So.
And just so people know too, I find this campaign so impressive because it couldn't happen at the city level.
Right.
You had to bring it all the way to Albany, so this had to be passed, and Cuomo even had to sign it. So why couldn't this happen at the city level?
Because it has to, changes to the vehicle and traffic law have to be made. So that's, it needed state level legislation, and then it comes back to Buffalo for the home rule resolution. So the state communicates with the city and says, this is what we're going to do, is this okay with you? The city says, oh yeah, it's okay, and then the state will pass it. But the reason why they were reluctant to do it was not only because of the parking in the Fruitvale, but because it was set a precedent for other jurisdictions. So now this is on the books, and medical campuses are not unique to Buffalo. They're all over the state and country. So now if they've allowed this to happen in this neighborhood, how many other neighborhoods are going to ask for residential parking systems where they have university people parking in their neighborhoods, medical staff, government employees in Albany, right? So there were lots of barriers.
Yes, and I'm curious, was the residential parking permit system, was there another example of that in New York State, or did you look to another city that already had that in place?
No.
Okay. Yeah, so that was an interesting solution to land on. And then also, as India's pointing out, it's so complex to really map what steps did this need to take. And we'll look at these tool pages later, but often in planning an advocacy campaign, you talk about who is the target, and that is the person, not an institution, but the person who can move your issue forward. So when you're talking about this, where you need the city to be on board, then you need the state to pass it, then it has to come home to the city for final approval and setting the actual mechanisms as they're gonna work. How did you set the map of who your targets are?
We escalated when we needed to. We knew that we would ultimately need the support of everyone at the table, but when it was time to agitate, we sort of started locally and then just moved up the ladder as needed.
And I think this is an interesting campaign too, because sometimes targets pop up that you're not expecting to have to face. So I'm sure you all had a map of, here's our political elected official targets, but then as you mentioned, this real opposition came up from a union. So maybe you can say something about that.
Yeah, so at the time I was a member of 1199 SEIU, so I was sort of shocked that like CSEA was at the table with us, but then like behind the scenes undermining what we were doing. So like, yeah, at a certain point, they had to become our target, and like, you know, in labor solidarity, usually that is like an absolute no-no, but it was like, you know, we have to do it for our people in order to win this. So we publicly shamed them, we did. They have the best parking on the campus. It's a part of their contract, their state contract, that they get reduced parking fees. And how dare you say that you feel unsafe among the people who you are charged with serving in this community? So.
Yeah, and that's one more interesting point that we should return to, is that sometimes a target is also at your table, your working group that is supposed to be working towards the goal. So Jessica, I'd love to hear kind of the same responses for you as you started pushing for that wellness policy. What were the long-term and some of the short-term goals? How did you set those goals? And then who were the targets for the advocacy? And I'd love to know if you have a kind of preferred planning tool that helps you mark those pieces out.
Sure. So we had this really innovative policy, and we were like, it's going to get fully implemented. But we realized it was a very progressive policy. I mean, it was kind of crazy that it got passed by the board. I don't think that they knew what they had passed. So getting them to fully implement it was, we knew would be a challenge. And we worked with Partnership for the Public Good, and we had a pretty broad-based coalition because we had gotten practice writing the policy together, which was great. I mean, in some ways it was sort of crazy because there was those of us writing policy that wasn't our background, but I think that that's an opportunity in Buffalo because we don't have a lot of folks who are skilled at writing legislation and policy. So you can kind of easily get to the table and work with Board of Education or work with Common Council and really affect policy, which is kind of cool. I didn't realize that at the time. But we said, like, well, what's kind of low-hanging fruit here? What seems pretty doable that they could do? And at the time, there was no recess in Buffalo Public Schools, which is very strange. And my daughter was in kindergarten at that point. And I didn't realize that. You know, we had written that into the policy, but I didn't fully realize that the kids didn't get recess because when she was in pre-K, they had gross motor as part of the curriculum, so she got recess. And then in kindergarten, I asked her kindergarten teacher, and she was in a classroom that literally opened up into a courtyard. I said, well, what time is recess? And the kindergarten teacher said, oh, they don't get recess. I said, they don't get recess? And I started asking, and I found out, oh my gosh, there's actually no recess in the district. I mean, for kindergartners, there's no recess. So we said, this seems like something that we can tackle. Recess is free. I mean, it's not a sophisticated health intervention, right? So we said, let's try that one first. And, you know, we decided, we planned a campaign. We went in front of City Hall. We got kids. We actually staged a recess there. So we had a pretty broad coalition of folks that were there from different groups. Again, we were able to tap into that coalition that we had practiced working with the wellness policy. We had little kids who were running around like with hula hoops and balls, and it was nice media staging, and that was also thinking about like what can we get attention around, and people were just like walking past City Hall saying, they're taking recess away from the kids, and we said actually recess has been gone for like 10+ years. Like, oh my goodness. So people kind of quickly mobilized around it, and again, I don't even think that a lot of the Board of Education members realized. I think that there had been this slow process. You know, sometimes you don't realize. We look at the inequities that exist in most of our systems, and it sometimes happens very slowly to the point where you don't realize it, right? And we had been so marginalized as parents that we didn't know what was going on a day-to-day basis, and there were so many bigger problems that something like recess didn't seem it just wasn't on our radar as much. So we had to push for a little bit, but pretty quickly and easily we got a commitment for recess, and then it had to be scheduled, and there was administrative pushback. So speaking to the point, it's interesting because these are very different kinds of campaigns, but I see a lot of parallels in terms of being at the table with certain people that were very helpful in one way, but administrators, building administrators pushed back a little bit on scheduling the recess because it was inconvenient. They suddenly had to find 15 minutes in their schedule. And we had to make the case, like, this actually improves academic outcomes, right? But there was still a little resistance with administrators. And then we also worked as a next campaign on breakfast in the classroom, because there's such a high rate of poverty and there's a lot of kids coming to school without having a proper breakfast, and there's this program called Breakfast in the Classroom that the food service director was promoting. But the Buffalo Teachers Federation didn't want that because that was inconvenient for them. So what we did with that one was we showed up in front of the Buffalo Teachers Federation after trying to work with them, send them letters, you know, try to negotiate, like, this would be great, you know, the healthy kids are better learners and kids with a full belly can concentrate. But they were like, this is going to be inconvenient, there's going to be ants and rodents in the rooms, like, sorry, we can't do this. So we showed up at the BTF with breakfast. We set up a breakfast table, we went inside the BTF and brought a nice platter of sample breakfast foods for them, and the media loved that too, you know, they're like, just ate it up, you know. And I think it actually got respect from the BTF. It's a very powerful union. And we've worked with them on a lot of stuff since then, but I think that they saw our level of commitment, and it was a good strategy. I mean, the media really, we got covered by all the outlets, like, it was great, it was classic. I mean, again, we had kids out there, we had parents out there, we were like literally serving breakfast to Phil Remore, and he didn't quite know how to respond to it. It wasn't like an agitation thing in the traditional sense. It was like, here, Phil, we brought you breakfast, and he couldn't really defend against that, you know? So again, it was like picking those things that we could kind of get a little gimmicky with, that parents and students could help lead, and that were creative. And it was fun in a way too, you know? So I think starting out with those kinds of things, and then we got more into difficult issues. Like, we realized that the district wasn't complying with state standards for physical education, like very far out of compliance. K-3 students were supposed to be getting daily physical activity, and they were getting it once every 6 days. So it was pretty far out of compliance. But that took us time to realize that and to look at the state regulations. And again, that was a state issue at that point. That wasn't just a local issue. So we had to go through a very long process that took about 1.5 years of initially filing complaints with the district and trying to work with district officials. And it got up to the point where I had to file a complaint with the state education department. It's called a 310 appeal, and you can only do it if you're a parent on behalf of your child who's aggrieved. And then there has to be a whole adjudication procedure, and so that was a very long haul type of process, but eventually we did get the district to hire 35 more physical education teachers, and we worked very closely with the BTF, the Buffalo Teachers Federation, on that campaign because they got 35 new teachers. So I think it's a good example of, too, how you can have someone who might not agree on one issue, and it's okay, like, to maintain the relationships in some way, and also have them see you as fierce advocates, you know, like, at the end of the day, we're what's best for children, you know, and we can all work together to some degree, but we're parents and students, so this is what we're doing. And to form these alliances, so different campaigns sort of had some core partners, but different people that would be brought in, and some of that stuff was kind of easy and low level, like recess, and some was much higher level where we had to file state complaints and get adjudications from the state education department.
That's amazing. Yeah, and I think thinking about setting goals, this campaign shows so clearly how you can have this big overarching goal, and I'm not sure how you would phrase it, but it's obviously school wellness and improving the health and wellness of children, and then you have these very intentionally sequenced goals or mini wins along the way. And I love that lesson too of starting with the ones that are not only easier to achieve and low cost, but that also can be fun and even kind of relationship building with the exercise and the breakfast, and then go for the much harder goals.
I will say though, it wasn't all mapped out like with these tools and stuff here. A lot of it was like experimenting, and like we did try
Yeah.
stuff that, you know, health education is still a huge need, but it's so hard to pack it into a campaign. So we would try with that stuff, you know,
Yeah.
and it wouldn't work. Those two things were like, you know, we started to practice with things, but there was a lot of ways where we were just trying our best, and there was people with crazy ideas. So there's some ways that you can do mapping and tools, but part of it is also just figuring stuff out and experimenting. I mean, I would definitely do things differently in a lot of ways. And you get practice after you experiment with things and see what works, and you talk to other people that have done it. But I also don't want to give the false perception that we're like, okay, we've got this all mapped out, low-hanging fruit here, and we have this 10-year plan. Like, you know, part of it, especially in the beginning with campaigns, I think, when there's longer range
Yeah.
goals, is a lot of experimentation.
Yeah, I think a lot of us who have actually, you know, paid positions in this work, you get these tools in an undergrad class on social justice, or when you do a certificate program or some professional development conference, and they kind of sit in your filing cabinet. So this is a really lovely reminder, I think, for us too, that some of this exists and is a nice way to bring working groups together. I'm going to ask you guys one more question, and then we'll open it up for everybody. So we've talked about kind of setting your issue, knowing why a campaign is needed. It was very obvious in these two cases that there was a problem, and then setting goals and choosing who your targets are. And we got a little bit into starting to set the tactics and imagining campaign activities. So India, I'd love to just hear kind of what tactics, from media events to public hearings, many, many types of tactics that we're going to look at, did you use to really make the power of the Fruitvale residents felt, and what are some moments where that you felt really worked best for you?
So there were certain things that we did that like targeted the parkers. We tied balloons to everybody's car who parked in the neighborhood, or put fake parking tickets on them one day.
Okay.
There were a few smaller press conferences that not a lot of media came out to. We had teach-ins where we would invite employees from the medical campus, they never came, and also community to talk about like what solutions we could have for parking, because we really wanted to include low-wage workers from the medical campus. We didn't want to exclude them. So there were just lots of small little kind of community building things that we did, and also writing op-eds about parking and stuff like that. And one day we found out that CSEA was again like going behind our back and going to tank the legislation. So against the advice of my elders, the Fruitvale is kind of an older community. Most members of our neighborhood-based coalition are, I would say, over 60, probably. But I wanted to do like a different kind of protest, right? Like we've brought attention to people parking there with the balloons and stuff. People complain like, what if someone's allergic to latex? Like, all right. So one morning I just got up extra early, taped off some streets with caution tape, and stood in the middle of the street and stopped people from parking. I like sent emails to the news and was like, hey, there's gonna be a huge protest in the Fruitvale this morning. And they came and it was just me standing there. And people were like blowing their horns and like very angry, you don't own the street, and shaking, fist shaking. But what it did was got us a call back to the table to sort of figure out how we could take it just one step further to get it through. So we did concede to giving up 50% of the parking on all of the streets to campus employees for 3 years, but ultimately the state legislation passed, and now we're able to work locally to be able to get more long-term solutions. So that was a good thing.
And I just want to say too, you were not an organizer at Open Buffalo when you did that. You were a nurse.
No, I was a school nurse.
Yeah.
So when the police came and she's like, you have to leave, and I was like, well, I actually have to be to work in a half hour anyway, so like it's no problem, just don't take me to jail. So, yeah.
Very good. And you shared the kind of outdoor exercise, which I love. I've always loved that story. But what other tactics did you use through that campaign? What worked best? But I'd also think it's really interesting to hear, did you all plan a tactic that then didn't work at all?
Yeah.
Yeah.
Yeah, I mean, I think it's a leap of faith sometimes too, and I just want to lift up India's courage and bravery. I remember when you did that. I remember you posting on social media, and I was like, oh, I hope that works out for her. But it does take a certain level of courage. Like, I remember organizing protests or rallies or different types of actions, and like sometimes you really don't know who's going to show up, or like, so, you know, there was sometimes it was like me and my kids and like whoever I saw somebody coming out of City Hall, can you stand here with me for 5 minutes? I mean, sometimes it's just hard to get bodies, or people are like, yeah, I'm with you, Jessica, but I'm not going to go stand in front of City Hall. You know, I was sometimes really surprised and disappointed how many people wouldn't even do anything but just stand there, you know, especially if there was media. They're like, I can't be associated with that. And so I think a lot of it was just believing that this is the right thing to do and doing it, and even if you're going to be standing by yourself, you know. I had some really amazing parents that I learned from that came up before me, and I definitely think it was kind of passing the torch, and also the fact that we had an ally inside the Buffalo Public Schools, which that person is no longer with us, and it is incredibly difficult to get stuff done now. I mean, and you have to use different tactics. You know, we were able to employ like this top-down, bottom-up type of strategy a lot of the time, because we had an ally who actually believed that parents and students had deep wisdom and knowledge, and she would come to parent meetings and sit with us just to, like, you know, sit through these 3-hour parent meetings, you know, just have 3 minutes at the end to talk about free dental services that kids could get to, or what the common availability program was, and willing to take on issues like, we're going to do a common availability program, you know, which was highly controversial. And that was one that was really difficult. I think we were building successful things, and we were trying to tackle something like health education, and we were seeing the issues around sexual health in particular. But that's controversial in a lot of ways, and especially in certain schools. And I remember going to the first meeting, and the administrators were like, yeah, we got this, we're just gonna do a community and family info session. And I walked in, like, you know, even though I've been working with them, I walked in as a parent, you know, just to hear what they had to say. And it was 5 people up there, no people of color at all. This was in the east side. 4 of them were Buffalo Public Schools administrators, somebody from the county health department, and it was just very much talking at people, like, this is what we're gonna do, this is the data, this is why I encourage you to have condoms, and parents were like, oh no, you know, they were not having it. I mean, it was fights breaking out. I don't know if you were there at that meeting too.
I remember the rollout of the CAT program as a nurse.
Yeah.
And even like, they couldn't get the nurses to agree to participate. I just miss Sue, that's all I'm gonna say.
Yeah. But she was willing to take that on, and we were willing to support it. You know, I mean, after they saw, like, okay, clearly you don't have this under control, and to build trust and relationship, you need parents and students to be advocating for this. We came in and we worked with the district. They actually worked with us to help facilitate public meetings. And I think at that point they saw, like, oh, you're able to do things that we can't do. So if we want to do this, because we know it's good public health practice and good public education practice, we're going to need you to help us. And we really mobilized parent and student leaders. You know, we had started at that point a parent and student community health worker program. So we had parents and students who are up and from those neighborhoods and communities who are working in line with district officials to talk to folks and create a space where it wasn't just like a town hall and people were shouting at each other, but to do that in a participatory way. And that's one of the kind of non-traditional tactics that we used was, you know, we did letter writing, we would go to Board of Education meetings all the time, we would meet with anybody, but we really had a bottom-up strategy with parents and students and community. And we would do meetings where we use community-based participatory research to really understand where parents and students were at first and foremost, and help them to understand the issues, right? So they could come to that place of awareness. And I remember after we had done several rounds of the condom availability program meetings, there was a couple parents in particular who were adamantly opposed to what we were doing. But by the end, they could see, like, I don't want it to be this way, but I realized that it's this way, and became supporters because they were fully invested. You know, they had kind of co-produced a policy in a way that wouldn't have worked if that was just done to parents by the district.
Yeah. Okay. Very good. Questions, comments?
I don't know. So I think one of the interesting things to me about these 2 campaigns is like, especially with the parking issue, I don't know if you can talk about like, when different coalition partners come to the table, they have such different goals, right? So some people have the immediate needs of like, I just want to park in front of my house, right? And like other people are like, we need to build long-term power for communities of color, and like we need to get a land trust, you know, we need to like build out. And so can you talk about like in structuring like an issue-based campaign that is focused on winning a specific thing, how like you try and balance and like build both with the folks who are there to like park in front of their house, but also folks who are like, yeah, we need to get that, but there are other goals as well.
Yeah, so the broader campaign was the community benefits agreement. So a parking relief was a part of the CBA, and that was one of those things that we said was like, this is the low-hanging fruit. We already had the support of legislators that we could probably get the thing done, and we figured that if we could win this thing, then that would be the catalyst to win other parts of the CBA. But the medical campus did the parking study and then like left the table. So we were like, man, what now? And we figured that like land ownership would be the thing that got us the leverage and power to be able to put more pressure on not only the medical campus but the city, and also just the need to keep people in place. Yep, so the parking was step one in like a longer campaign timeline, and then there's like naturally occurring triggers that cause people to act, and then sometimes you have to like find something to bring to make it bubble back up. So all along the way we've been doing things like that, like 238 Carlton and the co-op. We just get involved in everything.
And have you seen any effect that people who were involved in the parking issue or who benefited from it have remained active in the push for a land trust in Fruitvale and have become leaders on the other issues?
Yeah, I think that the people who were the core of the parking issue have become the core leadership of how the FBCLT has moved forward. And then there's also like the advisory council now that takes on more sort of neighborhood issues outside of housing, while the land trust just focuses on the housing part.
Yeah, the strategy chart that we'll turn to after more questions on these campaigns, it really asks you when you're coming up with a new advocacy campaign about organizational considerations. And one is, how do you want your organization very specifically to be strengthened by this campaign? Expand your leadership group, increase the experience of your current leaders, build a base, raise money. And I feel that that's one where in the urgency of our campaigns, we really forget to ask those questions and build that in an intentional way. It's like, well, great if it benefits us, but what we're really trying to get are these goals. It's almost a whole different area of goals that we forget, but it's so important to the long-term sustainability. Yeah.
And I found that like having some sort of like process map, or, and it doesn't even need to be that complicated, but I've done some work on the New York Health campaign too, and like obviously when we start talking about universal health care, it's like people are like, are you crazy, you know? So we had to think about what could we do right now just to create some action and energy towards that. But at the end of the day, I mean, that's a piece of it, but we believe that all people deserve a right to be healthy and have the access to health care. You know, health is a universal human right, so it's broader than that. So being able to pull people in, like this is our long-term vision, and we have a cohort of people who just, you know, believe in these really broad-based principles, you know, liberation for all people. Like everyone should have equity, everyone should have justice and freedom. But that doesn't resonate with everyday people. So you have to figure out like how can we build a coalition and give people practice with working together. And sometimes people will fall off, I think, after that one thing that they really care about. But a lot of times you'll get at least some people that hang out, and then you can build the next thing and you'll pull in more people. And it's kind of this constantly evolving strategy. But I think that's a really good point, because a lot of times issue campaigns just focus on one issue, and a lot of, if they're based on anger and agitation and just that, people often go away afterwards. So having that mix of those two things, I think, is really important to build long-term campaigns and change.
Yeah, I find it helpful to like think of the thing that is the biggest goal I want, and then like work backwards from there. But I agree with what you said, sort of like the one-off things are not, I mean, like, the parking is not, we didn't win that. Like, we say we won it, but it wasn't really a win. What we really want is like for people to take into consideration the people who exist in neighborhoods before they start doing things to us, right? Like, that's really the thing that we want, is like community power and a say in the way we live. And the parking didn't do that, but it did make a statement that we do actually have some power, where people tend to feel defeated in marginalized communities, like there's nothing you can do. But now we know that there definitely is something that can be done.
I find with our campaign, you know, when we do community outreach and get to talk to people about the New York Health Act, and they say, so many people say, yeah, that sounds great. Sure, I'll fill out a postcard, keep me informed. But the real challenge seems to be getting at least some decent percentage of those people to be more active, to help out and expand the leadership. Because you had mentioned in your initial presentation, you were disappointed sometimes when you had maybe a press conference and you just wanted people to be there and they wouldn't turn up, and India resorted to doing an action all by yourself. So, I mean, that's what I've been struggling with, trying to motivate people to just do a little more, find something where they fit in, and I've been looking for ideas about how to better do that.
Well, when you find out.
Yeah, okay. I keep showing up at these. I'm looking for the magic answer.
And is the goal still to get the New York Health Act passed in the Assembly as well as the Senate?
Yeah, I mean, it passes. It's passed 4 years in a row in the Assembly by an overwhelming margin.
Yeah.
And for 2 years in a row, there was only one co-sponsor shy of having majority support in the Senate. But it splits completely Democrat, Republican. I mean, even the IDC, Independent Democratic Conference, there are Democrats who weren't really Democrats. They caucused with Republicans most of the time. For a long time, they weren't in support of it, but they finally came around a couple of years ago. I think they did it cynically, but it didn't matter. They're co-sponsors. So we only came up one short.
Really?
So
Okay.
right now, the focus is trying to help out candidates in the election who support. We're trying to, we're hoping we'll have a nice surprise November 6th.
Aren't we all?
Yeah, and I think that movement too is so, it's challenging because then there's debate within like the single payer community in general on both the state and a national level, and I think that there's issues with coordination, and a lot of people think it's nice but they don't believe that it could happen. And I know when I was initially involved, it hadn't passed in the Assembly in quite a while, so that was like a big win because it was reintroduced, and then it's good that it keeps passing. So it's like, how can we get people re-engaged in this in some way? And even letting folks know and getting the word out, like, we're this close, and getting behind, because really, like you said, it comes down to who's in the Senate, right? I mean, Democrats have to have a majority to be able to win on that.
Right, and I think there's a lot of momentum there, and that's why just a couple days ago, the lobbyists for Blue Cross Blue Shield wrote a letter to the editor against it, saying voters should be beware of this. So they know it's going to be an issue in the election, because, I mean, we're putting the information out there.
Yeah.
We're letting everybody who can know that there are candidates who support it. So if they want to see it happen, those are the candidates to vote for.
Yeah.
And the opposition is fully aware of that.
Yeah. And what's your base of folks when you say you want people to do more? What does your base look like right now, and what would doing more look like?
Well, we're volunteers. We're all volunteers. I mean, there's a campaign that's being managed right now by the New York State Nurses Association. For a while, Physicians for a National Health Program took it because the campaign is a coalition of all kinds of organizations. But PNHP took the lead for a while. I don't know how long that was. I've only been involved for a couple of years.
Okay.
But the end of last year, the New York State Nurses Association took the lead again.
Okay.
Because they started off decades ago.
Okay.
They were the ones that put the bug in Dick Gottfried's ear, and he's the one that has been
Right.
championing the legislation for 20 years now. But they've taken control of the campaign again, and they spruced up the website. They're starting to spend some money on it, but region by region, they have one upstate organizer. She kicked us off, she gave us some guidance and, got the initial meetings going, and then we were just kind of on our own, just a bunch of volunteers. So we pretty much do whatever we come up with without having any money. So we can do whatever fundraising we think we can accomplish. If we can pull people together to do it. We had one good one a couple of years ago because we happened to have a stand-up comic in our group. So he got all his friends together and we put on a show, and that was pretty successful.
Yeah.
But most of what we do is just people showing up because we don't have the money to spend. So we just have to rely on as many people as possible. We look for events. We were at the Elmwood Festival of the Arts, which was, it was a good event to be at. We were able to talk to a lot of people. But now the challenge is we're reaching out to those people and trying to get them to come to our monthly meetings and be active.
Oh, yeah. So, I found that the monthly meeting is probably not the thing that people are going to attend.
Yeah.
They will make a tweet, share your Facebook post, they'll come to an event, but like consistent attendance at a meeting is gonna probably be a very big challenge. I would say that you have a built-in base with NISNA, and I would take that and build a bridge to CWA, SEIU, and the other healthcare unions.
Yeah, we do. I mean, at the,
They're in there, right?
the public, Terry Legursky from CWA, she's our liaison with them.
Yeah, so how do you activate your members?
Surprisingly, a nurse from NISNA came to our booth at Elmwood Festival of the Arts and said, why didn't I hear about this through NISNA? So there are breakdowns. I mean, it's a huge coalition.
Yeah.
Full-time job organizing.
Yeah.
That board of campaign.
But they also have a lot of issues that they're working on.
Yeah.
They've taken over management of the campaign again, but they have other campaigns. They have the safe staffing, they have other things.
And even the progress that we made, like healthcare and health in general is under attack, I mean, in a different way, like we were making progress with like the ACA and we were in a position to be like, oh, well, we can take it farther, like the ACA doesn't do enough. And now we're seeing that even the basic stuff with the ACA is under attack. And so I think that just with the social and political climate in general, it's tough right now, I mean, people are constantly just doing rapid response and trying to hold the line. And I think with the healthcare issues in particular, for a while we were trying to activate medical students and residents, and the whole system is so oppressive in a way where like we would get first or second year students and then they would get sucked in, but they're the ones who are like young and activated and like willing to take risks, but then the system sucks them back in. And people who have been hurt by the healthcare system, it's hard to get those people involved or have had a family member because there's trauma associated with that, or people are sick and it's hard to pull them out to come and tell their stories. So I think that it's like a particularly difficult campaign, and sometimes just continuing to hold the space during certain times, like that's what we're doing a lot with our work with health and wellness in Buffalo schools right now, because it's a really difficult environment to make progress. And so just being able to hold the space until the climate shifts a little bit is sometimes really successful. You're still there and you're still standing and you still have something together. So I wouldn't minimize that, because a lot of times infrastructure just completely goes away and you have to start from scratch. But we also would do things like I think events are ways to engage a broader base of people. And this is a strategy that we've used with Partnership for the Public Good over the years, is bring in a higher profile speaker. We would do a national expert and then local experts and then do some planning and stuff, and that seemed to draw folks more. When Andy Coates, who was a New York-based physician, was the president of PNHP, he would come and do events for us, and we would market them broadly and use different networks, and that would draw people in because he was a national profile type of person.
Yeah, he's still willing to do it, even though he's not
Yeah.
Still willing to come talk.
Yeah.
But I find that your exact kind of campaign level is the hardest one, where you're waiting for a state level legislative change, and it's very hard when you get back in touch with all the people here to say, here are some interesting, engaging things you can do locally. And we're kind of struggling with this on bail reform now too, where it's really, we just need another round of it in New York State next year. And to come up with local steps that we can do in the meantime is a tough way to engage.
One of the strategies that we use is like having local resolutions filed, which basically mean nothing, but at least it's something that you can report back to your constituents that like, hey, the Common Council has endorsed support for
We have a
New
resolution
York
from
Health.
the Common Council, Town of Cheektowaga. We thought we had one in the New York County Legislature, but the sponsor, Pat Burke, didn't really explain why, but he stepped back.
I see.
He just said he met some challenges and he didn't want to elaborate, so.
I'm surprised.
But we're working on it. Yeah, I didn't want to push him, you know, he's trying to, he supports the New York Health Act, but he's trying to win an election and he had his reasons. At the time, it really didn't matter. He was either going to do it or he wasn't.
Yeah.
So, but yeah, we've had a couple of resolutions passed. Still working on more.
Add something?
I was just gonna add in terms of like other things that we try and do instead of like having monthly meetings, it's like trainings. And I find that oftentimes people are like more willing to come to a training than a meeting. So if we're gonna do like a lobby visit, or if we're gonna like do a series of visits to electeds, for example, we're like, okay, we're gonna do a training on like how to talk to your elected, or like telling your story, or like health and like how to talk to politicians. A lot more people from the base come because they feel like it's not just gonna be a boring meeting. And it gets people like ready to do the next step. So it automatically gives them like at least one or two things to do that they feel like they're like being more active. And I don't know, especially with some of the local work around immigration, we've just found like meeting turnout is not great, but then we'll do a training on the exact same topic, and then there's like 45 people in the room, and we're like, oh, okay. Granted, like a smaller portion of those people actually take action, but they're at a point where they're, you know, they are more informed and they're like ready to be mobilized. So sometimes when those crisis moments happen, or when issues do bubble up, they're like, oh yeah, then they can tap into some of those skills that you've already built in.
And you know what else is really effective? Being super annoying.
Yeah.
If you consistently
Tried and true technique.
call people, send email reminders, like inundate them with the thing it is that you need them to do, they're gonna cave. They're gonna be like, I'm just gonna go, so like he'll stop calling me. So that also is something that I have found works really well. Just the old fashioned, like what we already know we should do. Go out for coffee with the people who you see as potential leaders, knock on people's doors, stay in touch, send a postcard or a card. Hey, this is going on, these are our accomplishments, congratulations to us. If you want to take it a step further, here's how you can be more involved and do the next thing. But I have learned the hard way that people don't like to come to meetings.
Yeah. And 10 high-quality people who are doing anything is better than 100 people who really aren't.
Yeah.
Yeah, and we have a good core, but then I see people start to burn out.
Yeah.
Especially with this, it's gained a lot of momentum, and like you said, it's at a state level, but we're trying to stay active locally.
Yeah.
You know, so it's the challenge of keeping the enthusiasm up
Yeah.
while we're waiting for good news.
Yeah.
Right.
Exactly, yeah.
And I know I'm not the formal presenters here, but when, I think this is basically all what you're saying, make it easy for people to do something. And so I'm thinking about how we would have specific deadlines throughout the year, and then there was a 6 months period related to our schools and trying to find teachers. There was a 6 months period where like nothing really happened, but in the meantime, we would create toolkits for people to, yes, we would annoy them like 20 times and not just say, can you do this, or can you send this to all the folks that you know, but if you have a newsletter, here's language for your newsletter, copy and paste this. Send it to them 10 times so that I know I at PPG, we get all of these inundations with things, and like there is a literal difference between someone telling me to craft my own 2 sentences and a difference between telling me to copy and paste 2 sentences. Like that's an annoying thing to say, but it makes it easy for them. And then another way to do it is if there isn't an actual thing for someone to do, but you want them to feel like they kind of have ownership over what it is you're asking them to do and feel like they're part of the campaign. It's finding the stories, and it might go to what Megan had shared and what India and Jessica had shared earlier too, is just finding that qualitative data, that kind of story, and who are the different people you're trying to mobilize and why and what motivates them. And so finding the different types of stories. So maybe someone's motivated, and for us it was like leadership, or really inspired by kids, or really inspired by their communities. And so having those individual stories and not necessarily asking people to do anything, but they can share them, or they can, instead of showing up. So I think those are things that we found successful. They could share them in social media, they could share them at their meetings, they could share them in their newsletters, they could share them on their websites. But if you're asking them to share them, just like have a photo, copy and paste, like make it very tangible and easy for them to do that. And it is lower hanging fruit for someone to produce it, because you have a conversation with someone, you take a quote, and you can have them tweet it out, or have them send it in a newsletter, or have them put it on a thing. And yes, that is more like technology, like social media based, but I feel like a lot of people are interacting, especially in terms of advocacy, in a lot of those spaces as well.
And I just find that local electeds in particular are much more progressive on social media than in reality. Like especially on Twitter, because there is like definitely a state divide between like who uses Twitter, and so there's a very like democratic, progressive folks in New York City who are like on Twitter that they want to get their, you know, supportive. So I've found in particular they're much more willing to have lots of positive statements, at least. The mayor in particular, really, there's a vast difference between what he'll say on Twitter versus in local media.
So, very good. Let's look at some of these materials. I know you have to go pick up your
I'm going to
son.
pick up my little
But thank you so much for joining us.
joy.
Yeah.
So sweet. I love them.
So we've given you here kind of 2 different sets of materials. One is from the Democracy Center and one is from Midwest Academy. So the lower packet there, I'll just say what you have and you can look at these on your own. But both really start out with like, how do you pick your issues, set your objectives, set your strategy, and then pick your tactics. So I thought you could take these with you because they follow a parallel path but have some different questions and different tools. So just walking through the Democracy Center materials, this is really saying, a series of guiding questions to pick your advocacy objectives. This is quite a famous one, these 9 key questions for developing an advocacy strategy, the second piece. And their Democracy Center is good, I think, because they really say, here's how objectives are different from your strategy, here's how your tactics are different from strategy. And the strategy piece is nice because it says looking outward, what do you want, who can give it to you, what do they need to hear, who do they need to hear it from, and what are the actions to take, but then also does, I think to Megan's point, that inward look of what resources do we have, what resource gaps, what do we need to develop, how do we begin, and then the evaluation piece, which we actually didn't really get into here, of how do we tell if what we're doing is working. And then this has some kind of action pieces too, which we mentioned a bit, inside, outside strategies. But what I would love to do is turn to the Midwest Academy materials over here. And this is an interesting piece because I feel like this top sheet here, checklist for choosing an issue, I don't know that I've ever done this process formally, but I could imagine we do this informally. This is how to pick kind of which issue you're going to focus on. So I mean, even what we heard from Jessica of, if we imagine filling this out, issue 1, there's no recess, issue 2, breakfast in the classroom, issue 3, sex education, and what you do is then go down this list and do checks of, will the issue result in a real improvement in people's lives, number 1. Number 3, will it alter the relations of power? if you go all the way down to number 11, will it be non-divisive? This helps you weigh, what are we going to put our resources to for our first campaign? India has left, but we work together on criminal justice organizing between Open Buffalo and PPG Research. And similarly, we're actually having a 4-hour strategy session here tomorrow with about 10 people, so it's very funny. But we're weighing issue 1, do we work on bail reform, on that pre-arrest diversion program that I mentioned, or she's done a lot of work the last year to end low-level marijuana arrests in Buffalo. So as you can imagine, that issue 3 ticks a lot of these boxes, but is extremely divisive, right? So you have to weigh those things. So that's an interesting, any thoughts about choosing issues that you want to share before we go to our strategy chart?
I mean, I think that a lot of the organizations, and not all of them, but a lot of them are very values-based, so it's like, I don't care if it raises money, this is the issue for my community, right?
Yeah.
And then I think that oftentimes when we widen the coalition and we bring in other partners, they're weighing this, especially some of the more like divisive, is it winnable, like in a way that we don't necessarily at we're at that community level. And so it's helpful, like, even if we know we're just gonna do this issue because it's the top issue and like it doesn't matter, other coalition partners definitely are weighing it in different ways.
And I think even some of the same issues, you can pick mini goals and goals along the way that maybe do help it build leadership or can help it raise money to put towards the next campaign. And I think we just don't think of those a lot, so it's kind of a nice reminder. But the next page, I wonder how many folks have the...
There's just one other thing that it's interesting when I ask this question, will the issue, because there's also, these are ways of framing it for some of the variety of people that you might encounter. And so thinking about when we would talk to communities about education, and a lot of times people have a preconceived notion of what a school is, what a school does, what the school outcome should look like, and some of them are more grounded had been more grounded in tradition, some of them had been more exposed to sort of Western schooling, and so thinking about these different things are different ways that you can frame it for different people who are motivated in different ways. And so I think this is easy to look at, it's an easy tool to look at to say, we might not do this explicitly, but if we could do it explicitly, maybe we can have an answer of a way to say it, how can I make this easy to understand? How can I make this clearly have some sort of target? Because I think otherwise you're kind of just doing that anecdotally, but if you can do it in a way that's intentional, that might be more helpful and a lot less time consuming.
Yeah. And the next piece is the Midwest Academy strategy chart. I wonder if anybody has seen this or used this before. Megan says yes, yeah.
Yeah, so we do it for all our campaigns.
Okay. And actually, our MSW intern this year, Christopher, we just did this in a class too, I found out. So some people are using it. But this is
something that Nicole would really like.
Yeah. Good, bringing it on back. So you have this, and then the next page that you have, and we'll send these to you electronically too, is just actually the piece that you fill out. Yeah. So I would love to talk through a few parts of this, and did someone come here, we know about the New York Health Act, did anybody else come here with a campaign in the back of their mind?
Driver's licenses.
Driver's licenses,
Oh,
tell us more.
Ensuring equal access to driver's license in New York State for everyone, regardless of immigration status. So it's a statewide campaign that's been around for several years, this iteration of it for 3 years now.
Okay, so in our final 10 minutes, I would love to go through a few areas of this chart, and Megan, if we can put you on the spot,
Sure.
we'll all use that as the campaign that we're thinking of. So when you think of goals, I used this chart last week, again, around that pre-arrest diversion program, and under number 1, list the long-term objectives of your campaign. Some of our partners, I thought we were going to say, pass the pre-arrest diversion program. They said, decarcerate the Erie County Holding Center. So they went that big. You know, we want to drastically reduce and get people out of the holding center who don't belong there. And then number 2, state the intermediate goals for this campaign was to get a LEAD program operating. So how are you thinking of this with driver's licenses? What would our
So our
top
number
goal be?
1 goal is to build immigrant power outside of New York City. So New York State has had the history of a lot of immigrant issues, but it's almost always led by very large, well-resourced organizations downstate. And so this campaign in particular, not only because of the bad political history of upstate coming out against it, but also because of the need to build immigrant political power. That's the number 1 goal. Although different coalition partners have a slightly different view of that. And then the number 2 goal is to ensure equal access to driver's licenses regardless of immigration status.
And I think what's interesting is that you can have different number 1 goals and then be all working together on that number 2 intermediate goal. Because as I said, I mean, we have the district attorney at that table, who I think does not have the number 1 goal of decarcerating the Erie County Holding Center. Where we will soon have police representation at that table, because to get that program, you need to have police buy-in and input on the policies that they will then be using to govern that program. So I found that's an interesting piece, that you can have the different partners. Now, they also guide you here to ask, how will the campaign win concrete improvement in people's lives, give people a sense of their own power, and alter the relations of power? So this Midwest Academy is one of the oldest community organizing training schools in the country. Out of Chicago, they really come at this with this power relations analysis. But then number 3, I think, is very important. What short-term or partial victories can you win as steps towards your long-term goal? And I think, do you have any that you would put into the basket for this campaign?
So last year, our goals were to have it pass the Assembly and get it introduced in the Senate. And then some of the other short-term goals are about resources. So right now, the campaign has $6,000 in the budget, which is like nothing. So some of the short-term goals are actually fund the organizations who are putting all of their time into it. But those are the other short-term goals.
And then I find if you look all the way to the far column on tactics, sometimes the short-term goals can almost mirror the tactics. You could say you want to have 4 successful media events to raise more awareness of this. Or you could say, we want to meet these 3 elected officials and have a real conversation about driver's licenses with them. And I think sometimes we don't set up enough short-term goals, and we don't count our victories enough. I think it's so important in this work to count those as mini wins and as victories, and that's a part that we really lose track of. This same LEAD diversion table is, some of the people are so weighed down because they thought that we would already have an operational pre-arrest diversion program. Every other city that's had it, it takes 3 years of discussion and to get the police on board, but people came to the table really hoping this is going to be operational in 6 months without knowing that. So I think setting those, being very clear and spoken and explicit about these are victories that we planned for and achieved, helps people to not get that burnout and to get really pessimistic about it.
Yeah, and I would just add to that, even when you are explicit, it's people's lives, so people are also like at the end of last year, we talked all year about how getting it passed in the Assembly and introduced in the Senate was our goals, and to have strong leadership of directly affected individuals. And still at the end of the year, several people were getting deported because they can't drive, right? So there's still the community effects of the we're not changing people's lives, and so we always have to balance that piece.
And can I just make a comment in relation to that? Because I think that that's a lot of times, because I work on the service side of things too, that there's often a gap between advocacy and organizing work and real people's lives. And the building relationship piece is so key. So sometimes, I mean, I think it's very explicit when there's a shooting or a police shooting in particular, this is horrible, this is not just we need to organize around this, but there's this horrible tragedy in a family that's been traumatized, in a community that's been traumatized, and the immigration issue is very real in that way as well. So making sure that we're taking care of people through that process, whether the organizers and advocates or people that are directly impacted, I think is really important, and we can't forget that. And then in relation to the resources as well, we use an organizing framework called asset-based community development, which is not really well established in this kind of work, but I found it super useful just to think about resources in different ways besides money, because we're always under-resourced, but individual people can have lots of talents and skills that can help mitigate not having enough money. So I found that that's really helpful to like work, especially if it's a diverse group, to be like, okay, what's the issue? What are our needs? What are our assets? And now how can we match our needs and our assets to do something right now, you know? To be able to line that up in a way so that people don't get too bogged down. And I've done that with lots of different kinds of campaigns, and it helps people feel empowered even at the end of the meeting to be like, okay, we're walking away with some agreement on some of the needs and the assets, and to find ways to match up the needs and the assets and come up with whether it's a strategy or a tactic or something that we're going to do next that aligns both of those things.
Very good, yeah. And this, I do think that's such a good point that these are kind of older tools. This says 2011, but this Democracy Center stuff is from 1995, and the Midwest Academy is very established. And I think these older school, if we can say, organizing and strategy materials, they have not included like mindfulness and a holistic approach to the work and self-care. It's like missing from all of these. So I think that's a really important part of it too. This does then in the next column say list your organizational resources, including money, number of staff, facilities, reputation, canvas. When we did this again last week, I mean, we said we have this office that we can meet in. 2 of our other partners have offices that can share events. We have 12 different organizations already in the working group. And so in a sense, trying to count those strengths and assets. Any?
Yeah, so we have a steering committee of organizations represented by each region. So that's like one of the biggest assets is we are actually like a truly statewide coalition, and each of those organizations. So when we do lobby days in Albany or in district, we are able to cover like in district meetings in the majority of the state, which for immigrant issues is often not the case. So I think that's one of our big, resources. And organizational considerations. We also have several organizations in the coalition that are base building organizations. So their mission is to work with directly affected people. So we have a organization here locally that works with mostly dairy workers, Alianza Agrícola. So they have an incredible amount of experience in the Hudson Valley, lots of folks. And in that instance as well, there's several like incredible leaders and assets within a lot of those organizations. Internal problems, that's a fun one in this campaign.
Number 3 under organizational.
Yeah, I mean I could go through all of those, but
no, that's good.
It's very interesting because the history of licenses in 2007, the big organizations that brought licenses to Spitzer for an executive order at the time were the New York Immigration Coalition, my organization, which now is a little bit more statewide, but at that time was even more downstate, and the Make the Road New York, which is a huge immigrant organization base building, and that moment of licenses caused a huge divide between our organizations, and we're in like a pissing match ever since. But in this coalition, we're in the steering committee together, and so it's interesting because one, there's like a pretty horrific history around licenses in particular, but also all of these other issues that we both work on and all this funding that we both try and go for. And then we're like the very large organizations, and then the rest of the organizations are like small community-based organizations, most of them that have, like one of them is Justice for Migrant Families, whose budget literally was the $4,000 like re-grant that we they got from the coalition last year. So it's a very interesting dynamic in terms of the different members of that decision-making structure, not even talking about the wider campaign support.
And I think sometimes those tensions and power differences between partners at the table can go really unspoken and simmer along, and it's useful just to, even for yourself, list them out. So then this goes through constituents, allies, and opponents with some good guiding questions, so I'll let you read. And then the targets one, which for me is very important, because at PPG every year, for example, we, through our partners voting, which you may or may not know about, set a 10-issue community agenda, we call it. All of our 280 partners can pitch ideas, then they come together and vote on them. And we word them as, this government entity should do this because of this. So X should do Y because of Z. So in our public writing, we put as the target, the Common Council, the County Health Department should do this. This really reminds us that those entities are not targets, right? Because you can't walk in and meet the Common Council and have them say yes. So there's that second level of analysis that says, if we need the New York Senate or the Common Council to pass it, who are the most important individual people that have the power to make that happen for us?
Yeah, so I mean, one of the primary segments is Governor Cuomo and Lieutenant Governor Hochul. Hochul was the champion against licenses in 2007 when she was the Erie County clerk. So she led the charge along with a bunch of Republicans to get Spitzer to rescind the executive order he had done. So she's a big target, and as well as Cuomo. The reality is that the bill the issue can be changed administratively. So we have been focused on legislation because of the history, but our goal is also to get access to licenses, and we haven't been explicit that it's legislation. So it's been kind of interesting because the governor is always a target. When, you know, he had obviously this flirting with the left when he had a challenger, we did try and push him to take executive action. So definitely the governor and lieutenant governor, but as well transportation committee members, and chairs. So on the assembly side, it's Assemblyman Gant. On the Senate side right now, it's Senator Robach. That's probably going to change, hopefully. And Andre Stewart Cousins is also a huge target of ours. We have a pretty big base in Westchester and the Hudson Valley, which is where her district is.
And then we're going to wrap up, but the final column here, no, that's all good. It's just good to hear it all, is tactics. And this has some nice reminders of tactics should be in context, flexible and creative. We heard about some great ones. And then I find this one very important, directed at a specific target, because I think we plan all kinds of events, hearings, and we don't really think which of those targets, meaning individual human person, is this going to affect and move. And then the last page that you have is actually a checklist for targets, for tactics, that when you're saying we're going to go exercise in front of City Hall and reenact recess, I find this is a really useful page. Can you really do it? Is it focused on the primary target? And so on. And I think sometimes as we get together in working groups, we set this whole plan of tactics without really weighing capacity. Do we have the base to do it? And then you also end up having to drop a lot, which really demobilizes and kind of de-energizes people as well. So putting these realistic questions into the mix at the start, I think, is useful. Now, we'll turn to Jessica for any final comments as our wonderful speaker.
Good luck out there. I mean, I just think this is not easy work, and it's good to explore with a variety of different kinds of tools. And I've even learned a lot about organizing just from other sectors too, you know, because of the nature of our network. We work with health and human service and education providers, as well as organizers and activists and researchers. So just kind of borrowing some of those tools, like for me, learning about community-based participatory research from our academic partners has been hugely empowering for us as activists and organizers, because it's a different format than like a town hall kind of meeting that people feel engaged and everyone gets to participate. So I think just practicing with stuff and really focusing on relationship building at all levels is really, really important. And when you're talking about tactics and targets too, to think about, you know, for our case with the campaign that I was talking about, the superintendent never really mattered, you know, because we've had so much turnover in superintendents. So we knew that, you know, there were certain people on the board that would have power, the mayor, and like, so sometimes who you think is the person that holds power, or that you're trying to, that will have to make the decision eventually, is not actually the person that has the most power. Or to know certain things, like the superintendent right now does not like negative media, right? So like using media as a strategy versus like private meetings is a good strategy to have. So always thinking about like, who am I trying to get to, and what kind of tactic should I pick based on the assets of the group that we have? Because if you have nobody with media experience and you don't have people who are willing to go stand in front of media, well, that's not going to work, right? So kind of that like flexible, dynamic, creative approach. And I've really benefited from talking to lots of different kinds of people, even people that I disagree with, to clarify my thinking. So I would just encourage people to even talk about, I mean, this conversation is helpful because people are coming from different places, because sometimes we get insular and like just talking to people who think like us or who are working on the same campaign. So this stuff is more doable than you think sometimes, and just keep practicing with it and you'll get something done eventually. You know, there's a lot of good stuff going on out there, and celebrate your successes and keep at it because it's important work.
Thank you so much for coming. Kristen will send this out, and if you're okay, she'll share your contact info and my contact info.